Good day, everyone. My name is Dakkshan. I am from group number 25, and today I'm going to demonstrate to you and explain to you what is it what are the general care for surgical patients. Now, when we talk about surgical care, it is always divided into three parts, which is pre-operative, which is before the surgery, operative, which is in the operating room, and post-operative, which is after the surgery. Part of the pre-operative care, which is the first care that you will have to give to the patient, which I will demonstrate after this in the videos. One of the steps that you have to do is, as a nursing assistant, is you will have to give medication to the patient at least an hour before the surgery, and then you will be instructed to elevate the side rails as well. And once the medication is given, you should not let the patient get up alone. You should assist him if he needs to get somewhere. Good day, sir. My name is Dakkshan. Today I will be a nurse. Okay. What is your name, sir?
My name is Sanjeev.
Okay. Before you get into this surgery, you will have to take this medication first. Okay.
Okay.
Here's some water. Okay. After the patient has taken his medication, he should not be moving. So what can we do to prevent the patient from moving? Because there will be side effects after taking the medication. So, as to improvise, I will use this as a bed rail. So the first thing you need to do is you need to raise the bed rail and make sure the patient does not fall off. Another step that is included in the pre-operative care for a surgical patient is you will have to take their vital signs. Good day, sir. I'm going to take your vital signs today, okay? First of all, I'll take your oxygen concentration. Next, I will take your blood pressure. In the event, if the patient has any accessories that may disrupt the surgery or maybe disturb the surgery, you should assist the patient to get the accessories off him. So, may I take your glasses? As I can see, sir, you also have a ring. May I take that off too? Once you have retrieved these items from the patient, you have to store it properly. Other than that, you will have to dress up the patient in a gown, and of course, you have to cover the hair of the patient with a surgical cap. Once all of these steps have been done, then you shall elevate the bed to the level of the stretcher. Therefore, it will be easy for transportation once the patient is ready for surgery. Other than that, you will have to complete the surgery checklist. And now, during the operative period, we still do have to play our part as a nursing assistant by providing care, different forms of care for the patient upon his arrival to the room while waiting for his arrival for the room. So, what are the four things that we have to do? First of all, we have to prepare the surgical bed so to make sure it is ready for the patient when he comes onto the room, back to his room. Other than that, we have to remove everything from the top of the bedside stand except maybe basins, tissues, equipment to check the vital sign, a pen, and a paper. Besides that, we also have to obtain the equipment that is needed, such as like the oxygen or IV poles or a suction. And also after that we have to watch for the return for your patient so that we are ready when they bring the stretcher into the room so we can transfer the patient onto the bed. Now, so during the operation period, your job as a nursing assistant is you have to prepare the surgical bed for the patient, where it's fully equipped with a blanket, with pillows, and also you will need an extra blanket because sometimes the patients will feel cold post-surgery. Other than that, you'll have to prepare the oxygen or the IV pole, a basin, the vital sign equipment, a pen, and a paper. On top of that, you also need to prepare simple things such as tissues and so on for the patient to use once he has come back after the operation. Once everything has been prepared for the patient, upon his arrival, you should wait for the patient to come back. And once he has come back, you have to lower the rails of the bed and let the stretcher come here and then assist the patient. Make sure the stretcher and the bed are on the same level, and then you will have to assist the patient to get onto the bed. Now, I'm going to explain about the post-operative care, which is the care that you should provide after the operation is successful. Now, one of the things that you have to do is after the anesthesia effect wears out, you should identify the patient. Besides that, you should check with the nurse if there are any special instructions needed for this patient, for the care of this patient. And furthermore, we also have to inform the nurse if the patient is not, if we cannot arouse the patient. What that means is actually if the patient is not conscious, we need to constantly check on his consciousness. And lastly, before I get into the videos of my demonstrations for post-operative care, another thing that we have to do is we have to constantly monitor the temperature of the patient so that it does not go too high or it does not go too low. As part of the post-operative care, you would need to take the vital signs of the patient. So I'll take your vital signs right now, okay? Do you feel any pain, sir?
No.
Okay, that's good. Now I'll take your oxygen and your pulse. Is there any pain, sir?
No.
Okay, sir. As part of the post-operative care, you will also have to encourage the patient to move as much as he can. This will help to prevent bed sores or pressure ulcers from forming. So, today I will need you to do some leg exercises if that's okay with you. Okay? So I want you to push your feet forward and back. Forward and back. Okay. Besides that, sir, if there is any way that you can move yourself around the bed, I would encourage you to do so. Okay?
Okay.
Now, for another step of the post-operative care, you actually have to encourage the patient to do deep breathing exercises. So, sir, we're going to do some breathing exercises. Okay? So I'm going to count to 3. You'll breathe in and then you'll breathe out. Okay? 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Breathe in. 1, 2, 3. Breathe out. Another vital part of post-operative care is you have to change the position of the patient. If he cannot do it himself, you will have to assist the patient, as I will do right now. Sir, I'm going to move you to the side so that you have some movement on the bed, okay? Okay. In the event, if the patient needs to move, you shall assist him. That is why you have to make sure that the calling signal is nearby the patient. Sometimes, post-surgery, the patient will feel nauseous, and this may cause him to feel like vomiting. So what we should do is assist the patient. when he has to vomit. So, for example, like I will demonstrate right now. If you remember correctly, in the previous method, we would actually prepare a basin for the patient. So next thing you have to do is you have to help the patient turn his head and then vomit into the basin.